Alright.
Okay, my speech is about why we care about breast cancer research and awareness. Did you know that for women in the United States, breast cancer death rates are higher than any other cancer besides lung cancer? It has been said that about 1 in every 8 women will develop breast cancer over the period of a lifetime. In 2010 alone, it was estimated that over 39,000 women were expected to die in the United States from breast cancer. This is a serious issue that shouldn't be taken lightly. This type of cancer can affect not only all women, but also women who are close to your heart, such as your mom, sister, aunt, cousin, and dear friend. Most people believe that as long as no one in their family has a history of breast cancer, then they are safe from getting it. Unfortunately, I need to let you know that this is not always the case. Yes, there are lucky individuals out there who manage to not get this horrible diagnosis, but in all actuality, 70 to 80% of women who have never had a history of this in their family are in fact diagnosed. Now, this does not mean that women are the only ones who can suffer from this. Men have also been known to develop breast cancer. It may not be as common for them to develop this breast cancer, and that is because their breast duct cells are not as developed as women. But each year, about 1,700 men are diagnosed, and out of that number, around 450 will die from it. In order to understand what having breast cancer entails, you must first understand what exactly breast cancer is. Breast cancer is known as an uncontrolled increase of breast cells that could develop a malignant tumor. A malignant tumor is a cluster of cancer cells that can develop in the nearby tissues and spread to many areas of the body. It usually begins in the cells of the lobules, which are also known as the milk-producing glands, or it can start in the stromal tissues, which are the fatty connective tissues of the breast. Over time, the cancer cells spread, and once they reach the lymph nodes, they are ready to enter the pathway into the rest of the body. Lymph nodes are small parts of the immune system, and they are important for fighting infections. There are many types of breast cancer, and it is important to be familiar with all of them because in some cases, a single breast cancer could have a combination of all the different types. There are non-invasive types and invasive types of breast cancer. The most common is invasive ductal carcinoma. About 8 out of 10 cases are this kind. That is when the cancer starts in the milk passage, breaks through the wall, and grows in the fatty tissue, spreading to the bloodstream and the lymph nodes is now possible. There are many things you can do to ensure that you are protected by knowing the risks and prevention measures. This involves knowing your family health history, making healthy lifestyle choices, getting screened, and knowing what is normal for you. For women, it is important to know when to start checking for breast cancer. A breast self-exam is an early option for women who are in their early 20s. Anything that seems unusual needs to be reported to a doctor right away. It is recommended that in your mid to late 20s and early 30s, a clinical breast exam should be done every 3 years. After turning 40, this same clinical breast exam and a screening mammogram should be done every year. This should continue as long as you are in good health. A mammogram is an x-ray of the breast. It is used to detect breast disease in women who may be showing symptoms or have an abnormal result in their screening. Different views of the breast are x-rays so that the most accurate diagnosis is made. A lot of people worry about the amount of radiation that they would be subjected to if they receive yearly checkups. A woman who starts getting mammograms at age 40 and continues every year until she is 90 will only receive about 20 to 40 rads. If you think about it, it's worth it if it will help detect breast cancer. However, breast cancer is not 100% preventable, and if diagnosed, it is imperative to know the best treatment options out there. Treatment has shown incredible progress over the past 20 years. There are many options that someone can choose from when it comes to deciding what treatment plan may be best. Discussing all options with your family and doctor is the first thing a patient must do. No matter what treatment is chosen, everyone can agree on one thing: being scared. Surgery and radiation are local therapies that can be used to treat the tumor without interfering with the rest of the body. Drugs can be given to the patient by mouth or through the bloodstream. cancer cells that may be throughout the body. Some examples would be chemotherapy and hormone therapy, otherwise known as systemic therapy. If a systemic therapy is given before surgery, its main purpose is to shrink the tumor so that the operation will be less intense. This is also called neoadjuvant therapy. Adjuvant therapy is done when the cancer is undetectable after surgery. The point of this is to destroy the hidden cancer cells that may break away from the breast cancer and spread throughout the body. These hidden cells may become new tumors in the body. The result of these many different treatment options is shown in the high number of survivors. From receiving the proper treatment, there are about 2.5 million survivors alive in the U.S. today. If treated properly, your choices of beating it are in your favor. Being prepared for what you are up against after the last day of treatment is important. Learning how to adjust as a survivor is crucial to move forward with your now normal life. Your whole life changes the moment you are diagnosed. Relationships with your family and friends, eating habits, and daily living experiences will change. Even though your hair is growing back and the IV is removed from your arm, the feeling of being tired and beaten up remains. There is no quick fix and the journey remains long. Educate yourself when it comes to stress and pressure. Understand that though the road may seem unending, there is always a light at the end of the tunnel. In the beginning, you are overwhelmed with so many different emotions. That numb feeling when you first hear the doctor say that you have breast cancer. Denial then hits fast because you feel that there's no way this could be true. The feeling of being angry creeps up because you can't believe it's true. Then there's the feeling of being sad and scared because you don't know if you're going to make it. Next is the feeling of being irritable because it seems like all of the routine treatments are hopeless. Then there's that moment when you feel like you can't breathe because you hear the doctor say that you're now cancer-free. That sigh of relief sends a calm feeling over you. This is a feeling that someone hasn't felt in quite some time. Going through all of these emotions has prepared you for the unexpected. The worst seems to be over, and now it's time to move forward. Having breast cancer does not mean that your life is over. It just means that a new beginning is about to start. That's it.
Very good.
Thank you.
You did a very good